For a month now, Illinois' COVID case count, hospitalizations, and deaths have been on a downward trajectory, but Governor Pritzker is still not ready to lift the state's indoor mask mandate. Illinois Department of Public Health Director Dr. Ngozi Ezike joins us now to talk about the state of COVID in our state. Thanks for being with us, Dr. Ezike.
Thanks for having me, Ben. Happy Friday.
Thank you to you as well. So what are you and the governor concerned about here?
No, of course, we are still in a level of high transmission as defined by the CDC. We are so happy to see that cases are going down week over week for the last month. Hospitalization numbers are down, although there still are 150 going into the hospital with COVID every day. That is a significant decrease, so that is coming down. So we are looking and following these hospitalization rates and the case counts to figure out when the right time might be to make any changes in those mandates.
You mentioned the improving numbers. Let's look at a few key numbers. 1,601 people hospitalized with COVID-related illness in Illinois right now. That's 0.01% of our population. More than 6,000 hospital beds are open statewide. That's about 20% of the total number of beds. So if the mask mandate was meant to make sure our hospitals aren't overwhelmed, aren't we there yet?
Right. So again, we're still following this virus and trying to figure out what its next move is. You know, we always have been concerned that fall, when people move things indoors, that might be a situation where numbers might rise again. So we're following all of these things closely. We all want the same thing, and we absolutely are going to move towards that direction as soon as we can identify that safe measure.
Are we close, though? I think is what everyone wants to know, because it's kind of a moving target.
Yeah, no, I think there are guidelines set by the CDC. We are seeing our numbers head in the right direction. So I want to say that we are close. We're not going to be wearing masks indefinitely. And I think we will want to take advantage of these numbers as they're headed in the right direction.
And I know you were asked about this a couple of weeks ago, this whole idea of kind of taking a more regional approach, because far as southern Illinois, they did run out of intensive care space last month. It created a lot of problems. It's a region, as you pointed out, that's got like half the vaccination rate of Chicago and the suburbs. But despite an increase in testing, Chicago is seeing an average of like 320 cases a day or so. I mean, 21 people hospitalized in the entire city, which is, I can't even do the math, 0.0008% of the city's population. Why don't we do a regionalized approach to should we wear a mask?
You know, there's so many bordering towns, and, you know, we're looking at the best way to effectuate this. And it can be confusing where people live within, several, might be at the intersection of several regions, given how, how these lines were drawn. So we want something simple. We want something that will be clear, that won't create more confusion than the answers it's trying to solve. So we will come to that, and I think it will be, I think it'll be sooner than later. And so I think people just need to hang in there with us. But these trends are absolutely going in the right direction. We are following it, every single day, and we are all working to get to that point where we can, have the mask come off.
I don't want to read into your words too much. Are you hinting that when you say sooner rather than later that you all are working towards a more regionalized approach, or do you just mean kind of generically sooner rather than later?
The truth is that all of the numbers in every single region are coming down, and the southern region that got hit so hard with the Delta, where you had literally no beds, they actually don't even have the highest case rate now. So we are moving in the right direction. The entire state is. So I don't think, we haven't nailed down what the strategy is to put out there, but I think we are all headed in that right direction to maybe get to a place where the mask could come off.
All right, let's talk vaccine mandates real quick. On one hand, United Airlines does a mandate, 99% of the employees comply, but the Chicago Police Union is saying as many as half the officers won't comply in the city. Do you think mandates work, or does it just cause people to dig in their heels?
It does a little bit of both. We absolutely get more people vaccinated with it, but we also will have significant challenges. And so we're seeing both of those play out, as you accurately just reported with those two examples. But the net gain is more vaccinations, and every single vaccine that goes into an arm does help us get to the point where we have a safer community and less cases and less hospitalizations. We saw that too clearly in our state, that the areas with the least vaccination had the highest case rates, and that continues to hold even now.
Yeah, that was remarkable to watch. It was a tale of two states there, with Southern Illinois and then those of us here in the Chicago region with the higher vaccination rates. Ari, before I let you go, I want to talk fun stuff. Halloween, just about 2 weeks away. Last year, I think it was on your advice, or maybe it was Dr. Arwady, our family made those candy chutes to deliver the treats without the touch. What are your recommendations for trick-or-treating this year?
Yeah, we are 1 year smarter, and we know how much safer these outdoor activities are compared to indoors. So, absolutely people should, get their great creative costumes, and they should enjoy as much as they can outside as opposed to indoors. But not everyone has the opportunity to trick or treat safely outdoors. So people who have to do it indoors, maybe in an apartment building, going door to door, if they can open as many windows and doors as possible just to promote that ventilation. Mm-hmm. If you are indoors, that's when, you would want to wear your mask. Use your hand sanitizer before you dig into that candy or as you're passing it out. But we know how to do this safely. We've been with COVID for quite a while now, so we just have to put all those things that we've been practicing for over a year and a half and put that to good use for Trick or Treat Day.
Dr. Ezike, thank you to you and your team at the Illinois Department of Public Health for all your work over the last 19 months. We appreciate it.
Thanks, Ben.